Hi, everyone. I'm Jeralise Diaz with the Record Journal. We're here with our new weekly segment, Ask the Expert, in partnership with Hartford Healthcare's MidState Medical Center, Community Health Center, the United Way of Meriden Wallingford, the Spanish Community of Wallingford, the State of Connecticut, and the Connecticut Department of Public Health. We'll talk about various aspects of the vaccine rollout and have a medical expert answer a weekly question. Today, I'm joined by Dr. Tilahun Gemtessa, infectious disease doctor at MidState Medical Center. Today's weekly question is, can people who are fully vaccinated still transmit the virus to other people?
Thank you for having me today. And that's an excellent question. So before I answer the question, I just want to clarify, when do we consider a person to be fully vaccinated against SARS-CoV-2 infection, COVID-19? So people are considered to be fully vaccinated after 2 weeks after receiving the 2 doses of the RNA vaccines, or 2 weeks following the receiving a single dose vaccine, that is the J&J vaccine. One thing to remember is that COVID-19 vaccines do not always prevent infection, like 100%. That's not possible. Fully vaccinated people can become infected without having any symptoms, or they can have very minimal symptoms and can still spread the SARS-CoV-2 virus to other people. But so far, like, we have a growing body of evidence that indicate people who are fully vaccinated, especially with the RNA vaccines, those are the Pfizer and the Moderna vaccines, they are less likely to have a symptomatic infection, that is infection without having any symptoms, or they're less likely to transmit SARS-CoV-2 to others. And something to remember when we discuss this point is the most important benefit of the COVID-19 vaccines is that they keep people from developing severe illness and ending up in the hospital. That's one thing that we have to remember. And we have several real-world studies that were conducted in the US, Israel, and the United Kingdom that show a profound reduction in asymptomatic infections, particularly with the RNA vaccines. And there was one small study that was conducted by CDC in California and Texas that showed that fully vaccinated healthcare workers were 25 times less likely to test positive for SARS-CoV-2 infection that were done as compared to those who were unvaccinated at all. And other studies from different countries, especially in people who were vaccinated with Pfizer COVID-19 vaccine, has shown that even if they develop COVID-19, they have a lower SARS-CoV-2 viral load as compared to unvaccinated people. So this observation might indicate that there is reduced transmission among vaccinated individuals, as the viral load has been identified as a key driver of transmission. And there were also 2 other studies that I'm aware from the United Kingdom that showed there is significantly reduced likelihood of transmission to household contacts from people infected with SARS-CoV-2 who were previously vaccinated for COVID-19. And so far I've been talking about the RNA vaccines. In terms of the Johnson & Johnson, that's the J&J vaccine, we don't have so much data yet, but it does look significantly to reduce transmission. Further studies are currently underway to learn more about the benefits of the Johnson & Johnson vaccine. Saying all that, there is one small caveat, like people who are immunocompromised, like people who have cancer, people who are on chemotherapy, people who are on chronic steroid therapy, people who have uncontrolled HIV infection. This might not necessarily apply to them. Like the benefit of the vaccines among immunocompromised individuals might not be as other typical individuals. So immunocompromised individuals still should follow the precautions, wear mask, hand hygiene, avoiding large crowds, and so on, till we have more evidence to support otherwise. So in summary, what I would like to say is that the risk of SARS-CoV-2 infection in fully vaccinated people cannot be completely eliminated as long as there is continued community transmission of the virus. That's why we are advocating for all people to get the vaccine. So far, the Pfizer vaccine has been approved for people who are older than 12 years of age, And I expect the Moderna vaccine to be approved for the similar age groups sooner, 12 and to 15 age group. So that's what I have for today.
Thank you, Dr. Tilahun Gemtessa, for joining us today, and thank you all for watching. Tune in next week for our next Ask the Expert. If you have a question you would like answered, leave it in the comments and we'll add it to our list. Thank you again to our partners for making this possible: Hartford Healthcare's MidState Medical Center, Community Health Center, the United Way of Meriden and Wallingford, the Spanish Community of Wallingford, the State of Connecticut, and the Connecticut Department of Public Health.